Hello, this video is going to cover a common problem with cats, and that is alveolar bone expansion. So how to deal with this type of extraction. So let's look at a case I brought up here. This is a cat, and what you see in this video is that you have a very loose tooth. So this is affected by a combination of alveolar bone expansion, periodontitis, and extrusion of the tooth. So the cat is trying to get rid of it. So basically you can just pull that tooth out of the socket. The issue with leaving the socket open is that you will have a delayed healing. So you see here it comes out quite easily. So if you decide just to leave it open like that, it could take weeks to months before it finally closes and heals properly. So in this video, I want to teach you how to release that flap and how to close without any tension. So let's have a look at how you can do that. So basically you need first a scalpel, and you make that releasing incision mesial to that alveolar bone, and you make sure that you push firmly all the way down to the bone. And you continue the incision distally, like this. And the next step is to take your periosteal elevator to pry off that attached gingiva of the bone. And here I'm using a type periosteal elevator from dentinal. This is a flat-ended, and it is very sharp. So it can easily slide under that edge of this very firmly attached gingiva. So this gingiva is very fragile. So you have to be careful when you pry it off. And I always start at the corner and then try to move sideways. Because if you start at the bottom and then push up, up, up like this, then you may penetrate the flap. So here you can see I'm kind of moving sideways and taking small increments, millimeters at a time. Again, starting here, going under that edge, small increments, pushing it up. And once you get into that loose mucosa, now it becomes much easier. So you see it went fairly easy. Some of these can be very tricky, but this was a little bit easier. So I decided to extend that incision just a little bit to give me just a slightly larger flap. Again, just lifting here off of that tooth to expose more of the alveolar bone. And now what you want to do is you want to take away all of this diseased bone. You can see that all of this granulation tissue that is present inside the alveolus, and that, you see, it's quite loose in here, all this nasty tissue. So you can use a Lucas curette to scrape it out just like this. You can see just how much infected tissue is inside this alveolus. So the goal of this surgery is to remove all of this granulation tissue as well as the overlying alveolar bone, so you can close without any tension. So now I'm using a medium grit diamond football burr on this handpiece, and to remove this alveolar bone. So you just smooth it down with that burr, like so. And I'm just continuing here to smooth everything down. So you can see I'm just removing that bone with the burr. And you may encounter some vessels doing this. You see in this case, there was a vessel right here that was bleeding moderately. So don't stress out too much about this. It's not gonna usually be a severe bleeding unless you see pulsation. Then you need to deal with it. Like here, you see now it's starting to pulsate a little bit from this vessel. This means that it's probably not going to stop by its own, so you're going to have to apply some pressure. And I just kept going a little bit with the drilling until I decided to do something about this. So you can see it's now this is pulsating. So in this case, you cannot just leave it. You gotta apply some pressure. So there's a few things that you can do. The most simple is just applying pure pressure with some gauze and keep it there for about 5 minutes. In 9 out of 10 cases, this is enough and the bleeding will stop. Okay, so this is about 3 minutes later. I decided to let go of the pressure and see what we got. So let's see. Okay, very nicely, the bleeding stopped. So in this case, the manual pressure definitely worked. So going back and drilling, I of course have to be aware that I don't just rip up this vessel again, because then we're gonna start over. So I'm using this periosteal elevator to pry off that palatal side of tissue. And the reason we do this is because we need an edge to place our suture in. If we don't have a loose edge, we're just going to place the suture through the soft tissue into the bone. We need to go under the soft tissue and over the bone. So that's why we need to raise it from the bone so we can take a good bite. And you can see how I'm checking the tension with this flap, and it lays pretty nicely over that defect. That's how you check it. You want to place it over the defect and see if it stays there or not. So this edge is quite inflamed, and the nice thing about this diamond football burr is you can actually drill the inside of the flap, so you can use it to debride the inside of the flap. So instead of cutting away part of the flap with a pair of scissors, you can in many cases reduce or remove this epithelial layer that has been developed on the inside simply by running this diamond football burr across the inside of that flap. Don't use a round burr, don't use a tapered cross-cut tapered fissure burr, because this will destroy the flap, but a diamond burr will just debride it. So this is a very nice tip that you can use. And now it's time to suture. You want to use, this is a monocryl 5/0 on a reverse cutting needle, and see why I released the edge of the flap so that I can make a good bite here. So grab the flap, insert it at a 90 degrees, make sure you exit at a 90-degree angle. This will reduce tearing. Do a double throw here, and then 1, 2, 3, and 4 throws on top of that. And try to place the sutures about 3 millimeters apart and grab about 3 millimeter bites. So this part can be a little bit tricky. That's why I decided to go in from the other side, because I could get a better bite of that tissue in front of the flap if I went in from this side. So sometimes you have to adapt your angle and your insertion point. And that's the finished result. And it did heal uneventful. So something you can do, I don't do this every time, but you may have heard of the concept of lip entrapment. So most of cats, at least 2/3, they will develop some sort of lip entrapment after extraction of the upper canine. So that means the lower canine will catch the lip and it will like push it upwards like this. This could result in a small wound of the lip. Most cases resolve by themselves. You don't need any treatment at all. But I'm just going to show you how you can do a little odontoplasty. So you take a burr. This could be a diamond burr, fine diamond burr. In this case, this is an Arkansas stone burr. And you want to smooth around the tip a little bit. And you want to do this X-ray guided. So I had my X-ray that I was taking prior to the surgery, and this showed me how close to the surface that the pulp chamber is. So in cats, you usually cannot take off more than 1 millimeter before you risk getting too close to the pulp. So here I'm just smoothing it, making it nice and round so that it will not penetrate the upper lip. It's not something I'm saying you have to do every time, but I'm just showing you how you can do it if you decide to do it. So by drilling into this, you have now exposed some dentin tubules, and these tubules need to be sealed. And for that, I'm using some self-etching bonding agent here. And you rub it on for 20 seconds. And this will close those dentin tubules that you may have opened now with your burr. So it's going to create a smear layer that is incorporated with this bonding material and plugging those tubules. And now you want to air dry it just a little bit to evaporate some of the solvents. Then you light cure for 10 seconds. Follow the instructions from the manufacturer. Don't use materials that are too old because they won't work as well. And that's it. So just make sure that you don't go too deep. Use your X-ray to guide you. And this is a fairly straightforward procedure. If you like this video and you want to have more extractions video at hand, so let's say you have a lower canine extraction coming in tomorrow and you want to review this surgery, you want to see the exact step-by-step how to perform this surgery to avoid breaking the jaw, for example, then I've made a complete extraction video library that you can get access to. So just click that link in my bio to go to my website, and then you can get access to my video library guiding you through every extraction you need to know, and you can have it right in your pocket on your phone and pull it up whenever you need it. So just click the link in my bio to go and check it out. It's called the Video Extraction Library.